Hi, my name is Vicky. For anyone that's new, for those of you who have been staying and sticking with me, thank you guys. I really appreciate you. Today's video that I'm going to bring to you is the second portion of mine and Joy's conversation. I posted the first portion, which was diagnosis. If you haven't already watched it, please go back and watch it in my channel, on my channel. But this second portion is going to be about medications that we've taken. Now it does start with the ending of the first video. So it's just speaking about how we were informed that when you're pregnant, you're kind of your body is protected and shielded from multiple sclerosis, and so that was the ending of it. So that's what this video is going to begin with, but it is about medications and what medications we've taken, and whether or not they've worked for us, and our journey with our medications. So I hope it helps anyone that is trying or wanting to seek out new medication. If your medication is working for you, that is awesome. Again, this channel was created to help anyone with multiple sclerosis issues, such as myself. I've been diagnosed for 14 years, and I believe Joy is coming on her 10th year, I believe, of being diagnosed. But I hope you guys enjoy, and you guys have a wonderful day.
Was like,
Right.
okay, but I can't afford pregnancy, so
I can't afford a baby. Right.
I
Right.
look like a baby. What you mean having a baby? So
Yeah.
it was now so you're talking with the IV. Oh my God, I'm like stuttering with the steroids. I got that recently. I never did the steroids thing. My journey was like kind of like yours, but backwards, where
Mhm.
I had a spinal tap to confirm that I had MS, and they immediately started me on this medicine called copaxone, where
I was on that one too.
oh, there you
I've
go.
been on.
All
I've
right.
been on that one. Mhm.
Oh, see, look, okay.
Yeah.
I did copaxone. Oh my God, because now I'm like reliving this, and I'm happy to talk
Yeah.
about this with you because I literally,
Yeah.
besides like my best friend and best friends and like my boyfriend and now my girlfriend, like I don't really talk about it because it doesn't
Yeah.
really come up. But I
Right.
did copaxone when I was 20, and I did that for like a good couple years. I was shooting it, the different parts of your body every
Right.
day.
Right.
But the
Mhm.
only reason why I stopped taking that is because it was making my skin have all these marks. Like I
Mhm.
was getting all these dark marks around my body, and I was feeling self-conscious, and I'm supposed to be this young, sexy 20-something-year-old, whatever. And I
Yeah.
got all these bruises on me, and the shot, like, I don't know if it happened with your body, but my initial reactions is like when I would do the shot, it would burn, and then it would puff up, and then I'd have to have an ice pack to smooth it down, and then I would kind of like put some coconut oil or something on it to stop. So I went to my
Yeah.
neurologist, and I was like, I don't like how this makes me look, and I don't like how this makes me feel. So he's like, all right. So then he moved me on to the pill, Gelenia or
Okay.
Gelenia. I don't know how
Right. Yeah. Chilenia. Yeah.
Gelenia. So I
You said it
had,
right. Yeah.
oh, thank God, because I took that.
Yeah. Yeah.
So I took copaxone from 2010, because that's when the person did come to my house and did the first administered the first dose of copaxone, but then I had to do the self shots myself. So I did that
Right.
from 2010 to 20, ooh, I'm going to say 2013, no, 2012. And then after that, I moved on to copaxone. I moved on to Gelenia, and I was on Gelenia from 2012 to 20, ooh, I'm gonna say 17 or 8. No. I lied. 20, when did I have my breakdown? 2019. So 2019.
Okay. Oh,
So
last year.
I'm pretty
Very
sure it was
recent.
20.
Recent.
It was 2019. There was so much junk that was happening in 2019. No. 2018. 2018.
Okay.
because I'm reliving my breakdown and what happened and blah blah blah. So it was from 2013 to 2018, and from 2018, so that's what is that? Like 8 Lord, I don't know, 7 years, 7-8 years. I don't know. I was on there. I was on there for a while. I was taking the pill every day. But the thing was, I started to experience new symptoms where I was feeling, oh my God, I have it written down on my phone and all that shit. I have this young, where I was experiencing these things and I was like, this isn't normal. Like I think the bottom of my foot, my leg, the itching, I had this uncontrollable itching. There was stuff happening where I was like, this isn't right. Like something's not right. And then I felt, oh God, see now I'm just reliving this again. I'm like, oh no, this is annoying. It's annoying in a good way. Luckily I recorded it, but it was, oh Jesus. Let me just go back. Hold on, because I'll explain why. Because I went to the ER and I had to record this because they kept asking me things. So I don't know if I hope you're gonna be able to hear this. This is when I went to the Okay, so this is when I went to the ER at the hospital. I think this is what I said. Oh, hold on. I think because they kept asking me, what do I take? What do I take? What are my things? Blah, blah, blah. So I said this.
Gilenia, gabapentin. And then there was another one, but I can't remember the name of it. But I was denied it anyway, so.
Okay, so they kept asking me, like, what are you on? What pills are you on or whatever? So when I was having problems, I did go to my neurologist, and he prescribed gabapentin for me. And I was like, I don't know what gabapentin is, but now it seems like I'm taking like 4 different pills for these symptoms I'm having. And I'm like, why? Right. So then I wrote this up. Then I said this other note. I believe this says notes for the doctors while home. So this is another thing I said.
Notes for the doctor. If we're going to do this shot thing or medicine, whatever it is, I would prefer to have a medicine that stops the twitching in my leg, makes my brain stop feeling like someone's squeezing it in the middle of the night, no heart palpitations, and gets rid of the numbing feeling from my left foot and my right foot, up my leg, through my special area, and crawling up my stomach. I hope that is not too much to ask for, and we'll see how it goes.
Yeah, that's what it was. See, I had to replay that just to remember. So I had this numbing feeling at the bottom of usually anything has ever happened to my right side, but then something happened where I felt it in the middle of the night, like something clicked and it moved onto my left foot. And I was like, that's not normal. And then I felt numbing in my women area, which never happened before. And I felt this numbing feeling, and it was like coming up my chest. It was in my stomach, like in my tummy area.
Oh, that's an MS hug. It sounds like an MS hug.
Oh, it creeped me the fuck out. Like. I didn't like it. And I was like, no one's telling me what this is. I was like, what is this? And then I would wake up in the middle of the night and I felt like I couldn't breathe. It felt like someone was squeezing my brain. And I would wake up like I'm going to die. Yeah. And I was telling him these things, and my neurologist is like, blah, 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 like, I don't know. So they did do the steroids on me finally. That was honestly a year ago today.
Oh, wow.
Because I went to the ER on Easter.
Wow.
I'm just paying off, like, this next week.
Oh,
I will pay the full half of my insurance to pay for that ER
God.
bill.
Wow.
That bill, for me to go to the ER was $3,000 for all of this nonsense, and my insurance paid half of it. So I'm just about to finish paying.
Yeah, yeah.
So all this COVID-19, a bitch can't afford to go back to the ER.
To get sick.
No, ma'am.
Yeah.
But
yeah, I feel you on that. So for me, I when he diagnosed me, he was like, I'm gonna, he sent the nurse to get the steroids going. But then the following, I want to say 2 weeks after that, he put me on, well, he just gave me a stack of like medication videos and books. He was like an
Oh.
old school doctor. He was cool though, but he was an old school doctor who actually specialized in heart attacks at the time. He didn't even specialize in MS. Like,
What?
so he didn't, I mean, that's just who they sent me to. The ophthalmologist was sending me to the neurologist. They're at the same hospital, so I guess they were homies. I don't know. And so it wasn't like, it wasn't like he didn't specialize in MS, So then, so anyway, so he just gave me a stack of stuff, and he was like, just go and look through that, watch the videos, whatever, and then let me know which one you want. And I'm like, oh, okay. And so then, so I watched the videos, and of course, I'm just like very uneducated about it, and I'm just like, okay, which one's the smallest needle and the less amount of times that I got to take it, And so at that time, there was no oral pill or none of that when I was diagnosed. So then, so then he was like, I said beta seron, because that's the one that had the smallest needle. I don't know if you've ever heard of that one, but it's also an interferon. I mean, it's also DMT. It's injectable. And so then it had, so then I take it, I think it was twice or 3 times a week, and then at the same time or whatever, right? But I'd miss it a lot. Like I didn't know, I'd never taken injections or none of that, so I wasn't consistent with it. And so then I kept having relapses. So then he was like, well, you're going to have to get on something else. And I'm like, well, what are the options do I have? He's like, well, because it's a DMD, you're probably immune, or your body is already, tolerate, or what do you say, like immune to all the DMDs. So you have to go to something else. He's like tysabri, because all the other ones may not work for you. So then I started researching on tysabri, and there was this video or this article saying that tysabri was taken off of the market because it was placed back on the market at that time recently, because it had been taken off of the market because few people, I think 2 people have died. And then there was PML. So PML it's an infection of the brain. And so I was super terrified, girl. I was 20 and I was like, oh my God, like that is the last thing I need,
Yeah.
But this, and so then, but then that's when I found out I was pregnant, because I was like, I'm not getting on that. But then I found out I was pregnant. He was like, okay, well, you're going to get off of everything anyways. So I didn't get on that. And then I refused that. But then I, got on that, and I didn't get on that. I didn't get on anything. So then after I had my baby, I was like, okay, yeah, for 9 months I was good, and I could just do exercise, and I'll be good. You know what I'm saying? But no. So then I had the worst relapse. So then I went to another neurologist, because I went to this MS talk, like it was a MS conference, like that they have, like meetings with doctors and things like that. So then this guy that was helping set up the meeting was like, well, does everyone on this table, because it's like a dinner, it's like a dinner speech, like you have dinner and then they talk to you, like a conference. And so then they're like, I was like, yeah, I have a neurologist, but I don't think he's not really offering anything else other than tysabri, so I don't know if there is anything else. And he was like, yeah, let me get you this neurologist and let her know that I referred you. And then, so I don't even remember his name now, but so then I called them, and oh my God, it was like, really, girl, God was on my side like the whole time. Like they got me in, they were like, yeah, you could come in today. And I was like, what? And they were like, yeah, you could come in today. And I was like, oh, okay.
Do I need to move to Texas? Because that's literally a problem in the north.
That is
literally a problem. Oh my God.
It's actually a problem everywhere, but I don't know if it was, I'm telling you, it was God, girl, because like, I don't know how that happened. Like, it happens here too. There's neurologists, you can't get an appointment right away. You got to wait, like, so then anyways, so, but yeah, so I was, thank God. And then I even told the receptionist when I got there, I was like, wow, you guys are all, like, you guys are awesome. Y'all got me in the same day. And she was like, yeah, we have these reserved appointments for new patients. And I was like, cool. And so anyway, so then she was really awesome. And so she, you know, I was really bad at that time too, because I had like a bad relapse, because that was after I had my son. So then, she was like, well, this is what we're gonna do. And girl, I was on chemotherapy. I don't know if you've ever heard of that. Yeah,
I know chemo. I know chemo, but for cancer and stuff. Oh my God, you're on chemo too?
I know. Yeah. So it was called cytoxin. And apparently, well, you know, tysabri is some kind of a form of a chemotherapy. So from what I heard,
yeah.
And so is what's a new one? It's oh my God, I forgot the name of it, but it's another new one that it's also like a form of chemo. But anyways, so this one was called cytoxin, and I think they've removed that as a therapy for MS, because that was like an old school therapy, I guess. And so anyway, so then she was like, you're gonna get on chemotherapy, girl. And that day was so overwhelming for me too. I got in my car and cried because I was like, oh my God, I'm gonna lose my hair. I'm gonna, like, that's the first thing I thought, I'm gonna lose my hair. She told me that I wouldn't be able to have kids anymore, that my bones could be jeopardized, like I could have osteoporosis when I get older. Like, she told me all this stuff. And the only thing I cared about was my hair falling out. I was like, I don't care. I already have a kid. I don't want no more. I'm good with that. She even, like, it was so crazy that, and so serious that she even said, for this type of condition that you have, and because of you're so young, we can freeze your eggs at no charge to you. And I was like, are you serious? So this was all in one day too, girl. And so then I was like, oh my God. And so then she was like, and I forgot about this too. Yeah, I'm reliving it too. But either way, so she was like, you know, are you sure you don't want to freeze your eggs? I was like, no, I'm sure. You know, I'm sure I don't want to freeze my eggs. Like, what? And so then, and she's like, okay. She's like, just sign this waiver. Like, it was crazy. She's like, sign this waiver, and we'll get you on treatment as soon as possible. And I was like, okay. So it was a treatment. It was a cytoxin. It was intravenous as well, of course. And so then they just inject me, like, you know, and in the vein, and then it just infused for an hour as well. It's kind of like the steroids. But oh my God, if you've ever had chemo, oh my God, that shot, like the injection, not the shot, but the injection when they hit your vein, it's so different. It's such a different feeling, and it hurts so bad. So bad. And so, yeah, so anyways, for me it did. And so then so then I started that, and everything went well. It was once a month. So one Friday every month, my mom would take me to my mom took me to every appointment. And so she'd pick me up from work, and she'd take me to the hospital, then to get the infusion, and then she'd take me back home. And oh my God, girl, that weekend was okay. Like, if I push myself through it, because it, like, man, it makes your body feel sore, and like, oh my God, like the flu, like you feel like you can't keep in. For me, I couldn't keep anything down, like food. I didn't eat too well when I was on chemo, because it takes a toll on your body so bad. And even though I lost a lot of hair, thank God I didn't lose all of the hair. You know what I'm saying? And so when the day that the doctor told me that I was going to lose my hair, you know, because that was my biggest concern. I don't know why I was so dumb.
Yeah, no, it's okay. We all have to mourn. We all have to mourn our hair. It's fine.
So then I told my husband, you know, my boyfriend at the time, and I was like so scared that I was crying when I was telling him. And my baby was little, you know, he was a baby. And so then he was like, don't worry, the baby and I will go bald too. And I'm like, oh, so he kind of made me laugh. So that was sweet. But yeah, but thank God nobody had to go bald. But yeah, it was so crazy. Yeah, girl. So
applause to your man, by the way. Like, just because he
thank you.
He transitioned with you. Like, applaud to him.
Yeah.
Oh my God.
But yeah. So then after that, so I had my infusion for a year, but then a month after I had the first infusion, she put me on copaxen. That new neurologist put me on copaxen. And I was on copaxen also for, I believe, 8 years or so.
Cool.
5. I know it was more than 5. I know it was more than 5 years I was on copaxen. And yes, I did initially get the same sensation that you did, but then after a while, like they just told me to rub it in, massage it, you know, the area. And so then it was okay. I could tolerate it. So I was okay. But yeah, at the next, I'd have to take a Advil or something the day I took it, because the next morning I felt like a hangover without even drinking anything, you know, like I had a hangover. My head was pounding. Like I felt I didn't want to get out of bed. Like it was like crazy, like kind of flu-like symptoms too. But then, so then, yeah, so then that doctor, that neurologist, went to the VA hospital. So she wasn't able to see me anymore. So she recommended me to another doctor at UT Southwestern, which I am with now. And so they're like the MS clinic that they specialize in MS, like hardcore, you know? And so then, so which thank God, and it's really hard sometimes to get into that clinic. So because she referred me to me and my referrals. So because she right, so because she referred me, I was able to get in. And so now I'm still with them. But then I had a little, like, it wasn't like I had a little relapse when I switched doctors too. And so my new doctor at UT Southwestern was like, well, we're going to have to switch you medications. But she told me again, maybe your body is getting used to these DMDs. And so you might want to try something else. And at that time, that's when the pills were coming out, like Gilenya and all of that. They had just finished the trials for those pills, but they're still fairly new. So with new medication, like you don't know what's really going to happen. Like you don't really know all of the side effects because they're still kind of trying it, you know? So then I was like, well, I didn't want to be a guinea pig, you know what I'm saying? Like I was like, no, I don't want to do that because I don't know, you know, I don't know what's going to happen. So I was like, can we please just try one more, like DMD? And then that's when I tried Rebif, and she was like, okay, fine. She was a Rebif is the one I'm on now. Yeah. So then she did. So then now it's been 8 years, thank God, that I've been on Rebif, and I'm good. Yeah.
Wow.
Yeah, which is another injectable, and it's 3 times a week, that one.
Okay. Oh wow.
Yeah.
Oh no. I'm now to the point where shit, wow, what a jeez.
Yeah.
Oh my God.
It's crazy.
Oh no, I mean, after my pill experience, my doctor said I couldn't do any other pills or any other injectables. So so now that's what I'm saying, that what you started off with is where I'm starting on. So then I got introduced to something called okravis.
Okravis, that's the one I was thinking about. As I think I don't know if you've done research on that one, but I think that one's a part of a chemotherapy too. I'm not sure, but it decreases your immune system. Like it attacks you. Like it doesn't attack it, but it diminishes you. Like it affects your immune system a lot. I know.
Yeah. He was basically like, hey, so here's this other one that I think you would be good for because you don't like. So here was my rebellion stage, is where all the symptoms I was saying on the phone, they were happening to me, and it didn't seem like he cared. So then I was like, F all of the medicine. I just not taking anything. So I physically didn't take my Gilenya. I didn't take anything for 6 months. And then that's when I had that relapse, and then I went to the hospital. So then he was like, well, it seems like you don't want to take anything. You don't want to take pill. You don't want to take needle. So here's this other one called okravis. And, oh, by the way, it's like 0.0001% chance of you getting cancer. However, you take it once a year. And I was like, okay. So I just started okravis last May or June, one of those. And I did that last May, June. And then I took another one this past, like when January 2nd hit, that's when I had my other shot of this okravis for the second time. So then I'm supposed to be due for another one May, but then I'm like, Kofefe virus. So am I going to be able to take my okravis almost cancer medicine? in May. Who the hell
Oh
knows?
my God.
So,
Yeah.
but like you said, as of now, like when I was going through those symptoms, they did put me on the steroids and stuff, and it didn't really bother my body, thank God. It was just, they told me to like take like the nurse, the lady, all that. She was like, well, take the Tylenol and take Advil first, and then we're going to have this go through your body for about an hour. Excuse me. And luckily I hadn't had any side effects since then. Like I haven't had anything come up, but yeah,
That's
this
good.
okravis thing is like still new to me. Like you said, this is the first time I'm taking any chemo things, and I didn't tell my parents. Like this is the first time that I don't think my parents know. Well, I told them I was on a new something, but I just didn't say what, because I was like, y'all can't handle this. Like y'all can't handle what I'm doing, so whatever.
Yeah, but I've just read a little bit, not a lot, and I have a few people that I've spoken to that are on okravis, so just be careful with your immune system, especially with all this going on. But yeah, so I've heard that they're very susceptible to any virus or infection, and UTIs, I don't know, I mean, we're women, so
luckily no. No.
Yeah, okay.
Thank you for asking, but like luckily no. I had a UTI once, but no, I haven't had one in many years, thank God, because I can't deal with the itchy. Can't deal with any of that right now.
Yeah, it's horrible. I used to have UTIs a lot just because of, all of these medications that I've taken, they deplete me from water anyways. Yes. So like, and I'm really bad at drinking water. I'm trying, but
yeah, I'm getting better too.
So yeah. Okay, we'll work on it together then.
Yes. As we're not drinking water, but drinking.
Right. As we're not drinking water. Yeah. So anyways, so then what was I saying?
Just that okravis is like basically cancer, and you need to
like your immune system it becomes really low is what I've heard. But anyways, the friends that I've talked to, like they've also said that they experienced a lot of UTIs and stuff like that. But I used to experience UTIs, and so I looked up the symptoms for UTI. Dude, it's the same as having freaking bladder cancer. That's how it feels. A UTI symptoms are, look it up, like for real, like UTI symptoms are like bladder cancer symptoms.
Jesus.
It's so crazy, and I never even knew that. But yeah, so anyway, so what I do now is, I drink kombucha, which helps me. I don't know if you know that, but yeah.
Oh yeah.
So then, yeah. Okay, yeah, and then I drink like apple cider vinegar in my water, and like, so I have to keep up with that. If not, like, I will get a UTI, and I have to always be very conscious of that. Yeah, for me, it affects everyone differently, but yeah, for me, and I'm only on Rebif, like I'm not on any other, medication other than the natural remedies that I do, Every now and then I'll drink garlic and stuff. I don't know if you do any natural remedies, but like garlic is supposed to be like an antibiotic. Like, yeah, so.
I don't personally, but I'm blessed to have someone in my life that I love that cares, and she preps things for me. So it helps.
Oh, like, good. That's always helpful. Yeah.
Because that's why I'm like, in the beginning, and I don't want to shade my boyfriend / ex-fiance, because that's how far we took. I didn't marry the dude, but I was like, it was helpful to, and I want to ask you that too, because this is something that was a big part of my MS journey. But how was he for you? Because I was definitely leaning on him to be like, hey, like I'm going through this, and I don't know, are you still gonna be with me? Like, how do you feel? Like, if you want to, and I've had that conversation with him, like, if you want to leave me, like, just go ahead, because I don't know what my future's like. And he was like,
same,
bitch, what? Like, why? And I was like, I don't know, and that was something that I spoke with my girlfriend here. I was like, hey, look, I'm not pristine. I'm coming through with this precondition, and how do you feel? And she was like, okay. And
yeah.
So let's make sure that you don't die. All right, cool. So yeah.
Yeah.
How was it for you?
Yeah, for me. Yeah, for me, we had a lot of fallouts. We had a lot of fallouts.
Mm,
I didn't think we were going to make it. Like, it was so crazy, especially at the beginning. I was
mm,
depressed and didn't know it. We broke up so many
mm.
times, girl. It was
Oh.
crazy. And same like you know, we had the talk, like, you don't have to stay with me, you know, and he's like, you're crazy too, you know, but at the same time, we had a lot of fallouts because we didn't understand each other. He didn't understand it because, I mean, he's pretty healthy too. So no, we didn't
Same.
really he knew, yeah, he knew what it was more than I did, but he didn't know any details, or, you know, we're still learning together, you know. And
Yeah.
so at this point, it's like, it's frustrating for both of us. And then I'm having all these mood swings and
Mhm.
all this crazy stuff going on. And so, yeah, we broke up a lot of times, girl. Cops were
Wow.
called, all kinds of crazy stuff.
Oh,
Yeah,
wow.
it got crazy for a little bit. And so, but yeah, we, thank God, we got over the humps. And yeah, now he's like it's like a 360. Like, he changed a lot. Like, he helps me, he understands me now. He's actually like receptive to reading about it more and things like that. Every now and then I get out of hand too. Every now and then, like, I'll yell at them like,
Mm.
you know, I'm going crazy
Yeah.
here, you know. But no, I mean, him and my son, they both, you know, my son's like a little man. Like, he tries to help me, you know, but yeah, it's crazy.
He
But
gotta help his
he's, you
mama.
know, like I said, yeah, yeah,
He
yeah.
better.
But sometimes I know, right? But sometimes I feel bad because I'm like, I put a lot of pressure on him, like he's a little man and he's not, you know. But
Oh.
yeah.
Mm.
But anyways, but my husband, he helps a lot now. But yeah, we went through a lot. We, like I said, I didn't think we were gonna make it at one point. Like, my husband and I, like, I didn't.
I worry
So
about
yeah,
that
but
too, because I don't want people to, and I know I've talked with her and him about these things. Like, I don't want to be I don't want to be dependent on anybody. Like, my parents
right,
raised me to be independent. Like, you got to do this, and if you want something, go get it. Like,
same.
I'm not gonna help you do blah blah blah. So that was really much, that probably was my biggest fear, was just and it's not to say, again, just not to be ableist or against anybody that isn't able-bodied, but I was very
Right.
scared of losing my independency, and I was trying to just do things myself because I don't want to feel like I have to depend on everybody for things. So that was one of the biggest, like, emotional vulnerabilities I've had with my friends and people I loved and care for. So I'm glad that y'all still together, and I'm happy
Yeah,
that,
thank you.
you know, because
Yeah, and that, you know what, that was the same feeling for me. That's why when I was at the doctor's office and he was like, "Well, you should be fine. You need a little assistance for 10 years, but then after 10 years you're going to be in a wheelchair and someone's going to have to basically wipe your butt." You know what I'm saying? Like, that's how I took it. And so that's why it was like, well, might as well tell me I'm dying, because that's how I was. I was so independent. My mom's a single parent. You know, I think that took a toll on me, because I'm like, you got to do it on your own. Like, you got to do it on your own. Like, in my head, I have to do it on my own, you know,
of
but it's
course.
not like that. But you know what I'm saying? But at the same time, you got to be, you know, able to at least handle your own stuff, you know. And
Yeah.
so that's how that's how I feel too. I feel the same way. And I felt like, oh my God, you might as well tell me I'm dying if you're telling me that I have to depend on somebody for the rest of my life, you know. So
Yeah,
yeah.
I don't understand why. I feel like I mean, thank you for calling me, and I'm glad that this is happening, because I would love to talk to doctors face to face and be like, y'all need some sensitivity training, because this is not how you tell women who are newly diagnosed with MS or anything. You shouldn't tell us like this. It doesn't make sense, because I had
Yeah.
that talk too. It was like basically my fault for being a black woman in her 20s for having MS, and by the way, you're going to be disabled in 10 years. Like, what?
You know what's crazy though? When they told me that it's a Caucasian, that usually Caucasians get it in their 40s. But this,
Oh,
again, this was an old school doctor. This was an old school doctor, but that's what he told me. He told me that it was a disease that mostly Caucasian women get at 40. So I'm thinking, I'm nowhere Caucasian and I'm not 40. Like, I'm 20 and I'm Hispanic. Like, I have none of that. So I don't know. You know what I'm saying? But
oh,
I started researching and that wasn't true. But again, it's just that I feel, had a little lack of knowledge as well
yep.
when, you know what I'm saying, when he was telling me, because he was specializing in cardiac
attacks.
arrest and heart attacks and stuff like that at the time. So I don't blame them, but like, okay, if you don't know, just tell me you don't know. You know what I'm saying?
Right.
It's okay.
We're human. If you don't know, I would rather, and that's what was bothering me about being in the hospital in the first place. Because have you ever seen the show House? Oh, it's a medical show. It's this British. He's not Brit. He plays an American. It's a dude. It's a doctor who would solve cases, like crazy cases. It would be the best one I have. The best episode for me was when this girl, Caucasian, this white girl, came into the ER. No one knew what was wrong with her, and she was basically dying.
Excuse me.
And the doctor found out that there was a tick on her. Like she was suffering.
Oh, Lyme disease.
Yes,
So
but you know where the tick was? It was in this girl's pussy. It was in this girl's vulva. They were literally about to take her off life support. They wheeled her into the elevator. The Dr. House, runs into the elevator. He's like, take off her clothes. And they're like, dude, what the hell? He's like, no, I need to check her for ticks. He's like, this sounds like a lawsuit, dude. He's like, no, check inside her vagina. And I was like, ah! And then they peeled it back, and there was a tick sucking the life out of this girl, this 17-year-old girl, in her vajayjay. And I was like, oh. So that's how I felt when I was in the hospital for 3 days. No one knew what was wrong with me. And they were just like, well, she could have this, she could have that, she could have this. And then when they told me, it was kind of like, oh, that's it. It's your fault. Bye. Like, I didn't understand.
No.
It just felt like,
it's your fault for being born. It's your fault for being born. Oh my God.
And I'm like, if people have gone through this for several years, I know that medicines are still happening, but I'm like, how is it that people aren't getting told in a proper, sensitive way of, hey, look, this is new. We're trying our best to figure out what's going on. There's no cure for this, but we're trying our best. Please be patient. Something. Don't just let us off the hook and then blame us. And then it's like, well, you have to. And I also feel, by the way, I feel like I'm Bernie Sanders or something. But I'm like, for women of color, they're just like, this is what it is. Take it or leave it. There isn't any sympathy for us going through this. People who are new to something that's life altering. I didn't like, this is the most comfortable I've probably ever been talking about MS ever, because I couldn't talk about it without crying, like just crying and feeling bad for myself and feeling